When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
Good morning. I'm Dave Kaufman. In for Elias, we're going to find out now what an infectious disease specialist thinks of all of the work being done to find a new COVID-19 vaccine. Dr. Vihn is an MUHC infectious disease specialist and medical microbiologist at the MUHC and a clinician-scientist at the Research Institute of the MUHC. Dr. Vihn, thank you so much for joining us this morning.
Good morning, Dave. How are you?
I'm very well, thank you. I'm like everybody else, waiting with bated breath for a vaccine. And seeing the news this morning, research out of Oxford University in England saying that there's been progress made, but I'm gathering that nobody should be holding their breath, right?
Well, I think we have to look at it both ways, right? First of all, it's very encouraging that there are multiple avenues going down this vaccine trail with some very promising results. So that's very encouraging. But of course, we have to be also realistic. There's nothing that's going to happen in the next few weeks or even possibly the next few months. We're looking at several months if we're optimistic, or perhaps a year or more if we're realistic, before we can get a vaccine that's available to the rest of the world.
And once that vaccine is available, we need to have 7 billion doses of it, right?
Right. So I have to say that we're not working on a vaccine, right? The scientific community is working on their different kinds of vaccines, and all of these manufacturers, all of these researchers, all of these companies that are developing different types of vaccines can all probably contribute to the global coverage when they're eventually ready.
And that eventual, though, there is no crystal ball.
Well, there unfortunately isn't. Unfortunately, this is science, right? And if science was predictable, then we would have the answers to everything by now. But we don't. We don't have cures for many diseases, but we have treatments. We don't have vaccines for many infectious diseases, but we have some, and we've been quite successful with some of them, even eradicating some diseases. But I think we have to be realistic that just because we're working on it doesn't mean it's going to happen next week.
Dr. Vihn, is research ongoing for other diseases right now? Has research for cancer research or AIDS research, is that continuing apace, or is everything kind of on hold until we find a vaccine for COVID?
So you're asking a really great question, okay, because it's exactly that. That was the scientific landscape before COVID, right? Everyone was working on different types of diseases that affected humanity. With COVID, obviously there's been a prioritization. So a lot of funding for research has gone into COVID, and a lot of labs that were researching other diseases have also focused on COVID. And that's where we have to be careful. Obviously, COVID is a global priority, but we also have to not lose sight of the fact that there are other diseases that we also need to work on.
What do you think of what's going on in the States, the way that Dr. Fauci is being blamed for so many things right now?
I think that's really unfair. I have to say that I actually was at the NIH for several years. I actually rounded and heard Dr. Fauci speak. He's actually a very brilliant man and very inspiring, and he's actually very scientifically neutral, right? He wants to know what is the evidence and what is the data, and that's why he's an excellent teacher. To criticize him for that character, I think, is unfair, and it's not appropriate. He has no vested interest personally in saying one type of thing or the other. He's actually trying to guide science and science policy to benefit humanity. So the politics are a bit atrocious.
Why do you think, Dr. Vihn, that we, and I'm grouping Canadians in there as well, were told not to wear masks initially?
Okay, so I think we have to go back to the original conversations, right? There were several kinds of approaches. First of all, there was a shortage of medical types of masks, or what we call surgical masks, as well as what we call N95 masks, that healthcare workers absolutely needed to be able to care for patients. And also at the time, we didn't understand the transmission dynamics of this virus. So at the beginning, we said, well, listen, masks, and it still remains the same message, right? Masks protect a person from spreading. That's what they do, right? So if you have the virus that's coming out of your secretions, if you wear a mask, that minimizes the dispersion or the spread or the transmission or the contagiousness to other people. That message still remains the same. What's changed is that we actually know now that there are actually a lot of people, a larger proportion than first appreciated, that are actually asymptomatic or what we call pre-symptomatic, and they can be shedding the virus during that time. So that's why we have said at the beginning, we said, well, listen, if you don't have symptoms, you don't need a mask, and if you do have symptoms, you need to either stay home or go to the hospital. What we know now over the last 3 months or so of science is that you can actually have no or few symptoms and be spreading. And so that's why at the beginning we said, well, you don't need a mask if you don't have any symptoms. But now we know, well, in fact, if you have no symptoms, you can still be spreading, so you should put on a mask. And that's why we should be wearing masks now, to try and prevent transmission. Even if you don't feel any symptoms, you can still be spreading, and that's why we need a mask.
A few minutes left with Dr. Don Vihn from the MUHC talking about a possible COVID-19 vaccine and, well, our life with COVID. Dr. Vihn, if you were making the decisions, would bars and restaurants be open in the province of Quebec?
Yeah, well, I'm glad I'm actually not making that decision because it's not an easy one. Okay,
right.
Obviously, I'm not an economics expert, and there are economic issues to consider. There's the livelihood of the bar owners and the restaurateurs, and that needs to be considered. I can tell you, as a physician and as a scientist, it's a bit concerning, right? Because the whole concept of bars is to socially mingle, right? That's you are going to meet other people, to share, to have a drink, to be in proximity, to maybe share food as well. That is the whole purpose of the bar scene, unless that's changed since I was a teenager, but that's probably the bar scene still. Unfortunately, in the context now of the pandemic where we need to encourage, again, social distancing, it's hard to resolve those two concepts. It's hard to say, well, we're going to have social distancing, but we're going to encourage social mingling. And that's where the bar scene is maybe a little bit in a difficult situation.
Is it making your job harder to have bars open?
It's not making just my job harder. I think it's making the healthcare system a little bit trembling right now, because what we're afraid of is that either the bar scene or, more importantly, the social gatherings that are perhaps not adhering as strictly as they should to public health measures, that may be the start of the second wave. Now, is it going to be a pebble in a puddle, or is it going to be a boulder? And that's what we're not sure. We're seeing the second wave start to come out of some of these social deconfinement activities. The question is, how big of a wave is it going to be? And that's what's concerning the healthcare system right now.
Finally, Dr. Vihn, as we finish up with Dr. Don Vihn from the MUHC, a clinician-scientist at the Research Institute of the MUHC, can we have bars and schools open at the same time? That
is going to be hard to tell. Right now, it looks like we have to be able to implement the same measures, both in schools as well as in bars, about good social distancing, good hand hygiene, masks as much as possible. If you're not going to be able to respect the 2 meter plus rule, and then we'll see. But I don't know if we necessarily need to have them staggered. What we certainly don't want, however, is that the social gathering, including the bar scene, prevents the opening of a regular school season this coming fall.
Dr. Don Vihn from the MUHC, thank you so much for your time this morning, sir.
Thank you.